Let's talk about heroin. Heroin is an opioid. So in this video, I will talk about the clinical features of heroin use, what are the features when the patient withdraws, and how to treat a heroin withdrawal patient. So heroin, as it's an opioid, it's a strong opioid, it produces the classic effects of the opioids. So initially, the patient is very happy, is euphoric, and this sense of euphoria and the calmness is very good initially. But later, when the patient takes a higher dose, this euphoria is converted to a depression, a CNS depression. And whenever there is CNS depression, this leads to a reduction in the respiratory rate due to the depression of the respiratory center. And the patient often becomes comatose. And if the patient has severe or very high overdose, this can lead to death. And the physical manifestation of a patient who has overdosed with heroin may also include the pupillary changes. Usually, the pupils become pinpoint, or there is miosis, pinpoint pupil or miotic pupils. So if a patient comes to you in the emergency department who is unconscious, has a very slow respiration, and the pupil are pinpoint, one of the differential will be a heroin overdose. Now, what are the withdrawal features of heroin? What happens when a patient withdraws from heroin? When patients can't take heroin for a few days and they develop severe manifestation? There are a few grades of heroin overdose. The grade 0, or the initial grade, is when the patient develops the craving. They want to have more heroin and they become anxious. In the second stage of grade 1, the patient develops yawning. They yawn, they have increased lacrimation, they develop tearing, so lacrimation or tearing. And there is also increased secretion from the nose, which is known as a rhinorrhea. Yawning, rhinorrhea. Rhinorrhea is classic feature, yawning, lacrimation, rhinorrhea, and there may be sweating. In the grade 2, the patient develops additional symptoms. Their eyeball, the pupil starts to dilate. So they develop mydriasis. There can be skin features such as erection of the hair follicle, known as the piloerection. Piloerection. And then they can also develop tremors. If the patient has more severe withdrawal, they would develop what is called grade 3 and 4 withdrawal. And here, the temperature of the body will start to rise. There will be activation of the sympathetic nervous system, excessive activation of the sympathetic nervous system, leading to a tachycardia, a high blood pressure, and tachypnea. And obviously, the patient will become agitated. The patient can also have, additionally, the patient can also have vomiting and diarrhea. In severe cases, the patient can also have a spontaneous ejaculation and orgasms. So how do you treat a patient with heroin withdrawal? The treatment is not just supportive, but you have to give the patient a heroin-like agent. Usually, the withdrawal program now we are talking about the treatment, how to treat a heroin withdrawal. So treatment usually begins if the patient has a grade 2 sign, has the grade 2 signs such as mydriasis, piloerection, tremors. And the usual withdrawal program is with methadone. We use methadone starting with 10 milligram orally. That is the usual medication for withdrawal. If the signs of the withdrawal persist for even more than 4 to 6 hours, then we can give another dose of methadone. An alternative and maybe an adjunct to methadone will be clonidine. Clonidine is an alternative and an adjunct. The usual dose is 0.1 milligram